Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer, and today, Dr. James Bridgers, who is our Deputy Health Officer, is going to be part of our panelists, as well as Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security. Reporters, you all should have already permission to record. If you do not, use the chat to ask for it. And with that, to you, Mr. County Executive.
So good afternoon, and thank everybody for joining us in our weekly press briefing. I hope you all are enjoying a slightly relaxed life now, and that you're able to go out and enjoy things. And I know as I go around the county, I continue to run into people who are just so excited about being able to do things again and to be able to do it in an atmosphere that people feel is a safe atmosphere. So I really hope you're participating in some of these things like everybody else is. I will confess I've seen my first concert and I've gone to my first 2 ball games. So I haven't done any of this stuff in so long. It's nice to be able to do a few of these things again. Today, our positivity rate is at 0.45%, and our case rate is 1.02 per 100,000. Yesterday, we were the only county in the green zone. Today, I think Somerset's in the green zone. We're in the yellow zone because we're over 1 per 100,000, but 100,000 is a pretty astounding number. We were at 1.02. We saw 15 new cases yesterday. 60.9% of our residents have received both doses of Pfizer and Moderna or a single dose of J&J. And it's great news. Montgomery County is number 1 in the nation among all counties over 300,000 residents for having 71.7% of our 12-year-olds and older portion of the population vaccinated. That's a real tribute to the folks who've been doing this work. I get to be, the chief administrator of this, but, it's really, hands off or hats off to the Health and Human Services Department, Dr. Gales, Dr. Bridgers, and all these teams, and all the community groups that we've partnered with to make sure we're able to get vaccines deeper into the community. So it's been a great collective effort, and I just want to thank everybody for that. We have 76% of eligible adults over 18 are fully vaccinated, and we're nearing 90% of our residents over 65 being fully vaccinated. And I'm really especially happy with that number because these are obviously the most vulnerable people. We know that COVID's not going away entirely. So the fewer of those people who remain unvaccinated, the less the risk is of any of them winding up in a hospital and the worst outcomes that age group has been subject to. So that's a pretty significant number. We've been benchmarking, against other counties. We show both the Maryland data and the CDC data, and, the CDC data is a little bit different than the Maryland data. And I just want to, reiterate the difference is the CDC takes account of all county residents wherever they were vaccinated. So if they were vaccinated in DC, if they were vaccinated, someplace else out of state, they get counted. Whereas the Maryland data is based on the information that comes through the Maryland portal, which does not capture these out of county vaccinations. So it's pretty significant. We're at 71.4 of that 12 plus fully vaxxed. And again, really happy about where these numbers have wound up. This week, we updated our guidance on masking in county government buildings. The wearing of masks in most county offices and facilities is voluntary in most civil situations for people who are fully vaccinated. Unvaccinated persons are still highly encouraged to wear a mask. We know that there's no way of proving without doing things that we're not going to do, who's been vaccinated or not. But we're encouraging the unvaccinated for their own sake to wear a mask. I want to reiterate, the danger is less that an unvaccinated person is going to infect a vaccinated person. The real risk is for an unvaccinated person who contracts COVID and doesn't know it to infect another person with COVID who's also unvaccinated. So this is still an effort to try to make sure we close the door on as many ways that this disease manages to transfer itself from one person to another. So I hope everybody understands we're not wearing masks because we're worried about the being safe for everybody. We're primarily worried about the people who aren't vaccinated getting sick, and we don't want that to happen. This Saturday, June 13th, our Department of Alcohol Beverage Services will return to normal hours and expanding hours under a new schedule for its 26 stores in the county. Starting June 13th, stores will be open 10 to 9 Monday through Saturday, and noon to 5 on Sundays. And please note that the Poolesville location does have separate hours as it's a spirits-only store. And there will be more of those stores in the county coming soon, we hope. On Monday, June 14th, we'll open 8 more libraries around the county: Aspen Hill, Damascus, Davis, Little Falls, Long Branch, Potomac, Quince Orchard, and Wheaton. These 8 new libraries mean that 14 out of 22 libraries will now be available for in-person service. Additionally, as we mentioned last week, senior centers in our permitting office will be open next week for in-person services. We also have heard questions from our business community about their own masking policy and if they can mandate their employees to be vaccinated. We want to continue to remind residents that any business, church, or organization can require visitors to wear masks. Again, I want to make that clear. If the business says that you have to wear masks to come in, that is their right and it's enforceable. So please respect the business owners and the clients of those businesses where they've deemed it the most responsible thing to wear masks. And I have to say, I agree with that. If they require a mask, you have to abide by these rules. As far as businesses asking the county whether they can mandate vaccination of employees, that is not guidance that we can advise, and each company should consult with their own attorneys on whether that's possible. Our success with COVID cases and our vaccination rates have been the result of the engagement and creativity of our comms team. And to help convince our younger residents to get vaccinated, we've turned to those who know this audience best, which is their peers. And I'm pleased to announce that a recent PSA contest for high school and middle school attracted over 300 entries. This is great news, and we put out the word that we need more judges. And I look forward to seeing who wins this very competitive contest. Thanks to our communications folks, as well as MCPS and the other schools in the county for promoting and participating in this contest. Our Latino Health Initiative and our African American outreach efforts continue to utilize a variety of creative and targeted outreach proposals, and they are attracting outside partners such as Johns Hopkins. And we've built a strong partnership with FEMA and the State Equity Task Force. There are 48 FEMA sites have distributed 3,300 vaccines in Moderna and J&J. And we continue to do site visits in targeted areas throughout the county with mobile, pop-up, walk-up, and door-to-door vaccinations. We're not letting up on the vaccination front. I don't want anybody to think this is over. In our mind, it'll be over when everybody's vaccinated, and we'll keep vaccinating people until we've gotten virtually everybody who wants a vaccine vaccinated, and we're going to continue to work to persuade people who've been reluctant to get the vaccine to please get vaccinated. Starting today, Proyecto Salud, a partner of Montgomery County's por nuestra salud y bienestar, for our health, which means for our health and well-being. That initiative will be offering free COVID-19 vaccinations on Wednesdays and Thursdays from 1 to 6 p.m. at the Westfield Wheaton Mall. And vaccines will be available for individuals 12 years and older. No appointment is necessary. Vaccinations will take place on the second floor between the Target and the JCPenney. And we're grateful for our partners at Westfield Mall for their support. I was out there earlier when they were doing a food drive and helping to distribute food to the community. So they've been great partners throughout this. In the news, there are several issues that have been in the news over the past week that you may have some questions, and just wanted to touch on a few. Yesterday, the Maryland Transportation Authority Board, in a surprise, apparently nearly spontaneous meeting with all of 3 days' notice, unanimously approved several measures that pave the way for a public-private partnership that will widen and add toll lanes from I-95 from the American Legion Bridge to Old Georgetown Road and on the I-270 spur to I-370. Following this announcement, I joined Council President Tom Hucker, Maryland Senator Will Smith, Rockville Mayor Bridget Newton, and about 150 members of several organizations that are opposed to the P3 arrangement. And we gathered at the First Baptist Church in Rockville for a rally against this decision. This decision is absolutely fiscally irresponsible, and it pretty much defies common sense. I'm not going to go into the long technical details of everything that's wrong with this. I will say the one thing the governor has finally done that I agree with was starting at the American Legion Bridge. For those of you with short memories who weren't around in December of 2018, the week I got elected, both the governor and I addressed a large meeting in Montgomery County, and he talked about his plan, and I got up after him and I said, if you were serious, you'd start at the American Legion Bridge. 2.5 years later, we're starting at the American Legion Bridge. That was the right decision, but there still remains no reason to do 2 lanes in each direction. And, we continue to support the 2 reversible lanes. That was the council position when Martin O'Malley first proposed a widening of I-270 by adding 2 lanes in each direction. All of us who've experienced I-270, and I experience it every day, we know that going northbound in the morning, I don't need 2 lanes. Those lanes are going to sit empty. Nobody in their right mind would pay a toll when you can drive pretty much as fast as you want to going northbound in the morning. The problem is southbound, and 2 lanes that were available southbound in the morning would be really valuable. And the reverse is true in the evening. I don't need the lanes going southbound, but I do need them going northbound. Essentially, building a 4-lane project to solve what is a 4-hour project, 4-hour problem in one direction in the morning and the other direction in the evening, it makes no sense. For 20 hours a day, you will be unlikely to collect any toll revenue on this massively expensive project. So it doesn't make any sense from a money perspective. It doesn't make any sense from a planning perspective. Our master plans don't support the projections of growth that would justify 2 additional lanes going northbound. Another problem is he stops at the ICC. The idea that you're going to bring extra lanes of traffic, 2 extra lanes of traffic to the ICC, and then have that traffic merge into the same road that is congested past the ICC going up to Frederick makes no sense also. We ought to be doing this as a comprehensive project that goes from the American Legion Bridge to Frederick. We need relief, but we need it in one direction at a time, and that's the best way to go forward. This is an opportunity to include rail options like Virginia is now looking at to support rail transit. And if we could bring more people from Hagerstown and Cumberland into Montgomery County and down into DC via rail, that would also take a load off this. And we need to support bus rapid transit, which is a far more economical way of moving people. But to me, the biggest thing, other than all the wrong things, is that, when this was originally hatched, you had a president who could care less about public works and building infrastructure. Now you've got a president who is making infrastructure the centerpiece of his administration and the importance of building infrastructure to support this country's needs. The American Legion Bridge connects I-270 coming down from the north and from the west across that bridge around the Beltway to 95 South. It is a major interstate link. And that bridge is due for replacement or repair within 10 or 15 years anyway, even if we did nothing now. This is a perfect infrastructure project. And the idea that we would go forward on a P3, which is going to cost county residents and non-residents enormously and have major impacts on the community before we first go to the federal government and say, we have a perfect project for your infrastructure plan, is a serious mistake. And I don't know how somebody who wants to be a fiscal conservative figures out how to spend, state and resident money before they look to help from the federal government for the kind of project that they're likely to actually support. So we're going to continue to fight and to propose that we focus on, an outreach to the federal government and a formal application for funds for this project. On other news, today we announced the county successfully completed the sale of $46 million in revenue bonds to refund 2 series of outstanding alcohol beverage service bonds. And this sale saved the county 16% over the original cost of the bonds, which equals $8 million in savings. The proceeds from the bond will be used to refund bonds that were issued in 2011 and 2013. And they were used to finance and refinance acquisition, construction, and equipping of certain public facilities, including the ABS warehouse. This is really great news for Montgomery County, and I want to thank Mike Covey and the Department of Finance for their guidance. I also want to point out for any of the naysayers who say, well, anytime you refinance, you save money. What's different about this is the remaining term of the bonds is the same. This is not like you refinanced the bond at a lower interest rate, but we also started the clock over again at a, say, 10 or 20-year period. This savings is over the remaining period of time that we would have been paying anyway. So we haven't extended the payments. These are actual real dollar savings, and it's a huge win for the county. We are laser focused on being good stewards of taxpayer money, whether it's the county budget or how we invest taxpayer dollars. Earlier this year, we once again received the AAA bond rating, and rating agencies commented on our strong physical management systems. And the bond sales, yet another example of my administration's effective management of finances of this county. As we look ahead to the rest of the week, we have 2 major events in progress with our life science and bioscience industries that I'm very excited with. First, tomorrow, I'm going to join Governor Hogan as we tour the new headquarters site for Novavax in Gaithersburg. Novavax's growth and investment in Montgomery County is not just great news for us, but it's equally important to the state and the entire DMV. And for all our bio and life sciences company, it continues to add value. As companies like Novavax grow, it's incumbent on us to help make sure we're providing a pipeline of well-trained and highly educated workforce. And this has been one of the things that Montgomery County has long been, I would say, evaluated as coming up short in. And so this Friday, we'll be announcing the creation of a landmark partnership with the signing of an MOU between the county and the University of Maryland, which includes USG and Montgomery College. The MOU will guide the future of post-pandemic education, utilizing existing assets to create an economic development powerhouse for Maryland in life science and regulatory sciences. The last 15 months have demonstrated that our bio, life sciences, and quantum computing companies are vital to our global security, and we must continue to invest in their success. As a county, it's imperative that we grow, provide this industries with workers and who have the skills and talents that they need to succeed. And so I hope you'll join us at the Universities of Shady Grove for this event and the press conference that'll come after it. I just want to emphasize, this is really important. You read all the stories about Montgomery County's sputtering economic growth and the fact that we've not been able to really create jobs for about 10 years now, if not a little bit longer. And that has been a longstanding problem. And we have not effectively addressed the reasons for why we're not getting the growth. We rezoned a lot of property, and that property sits vacant and unbuilt. The problem isn't the zoning problem. The problem is, what do you do to bring businesses, and what do you do to bring the underpinnings that are going to make a business want to come here? And you can zone all you want, but if people don't see in the county reasons to come to the county, they're still not going to come. And so we took a deep look at what the underlying problems were in this county, and particularly in industries that we consider to be critical industries. And this MOU and other work we're doing reflects the recognition of what we know we need to do if we're going to move forward. So before I turn it over to Dr. Gales and Dr. Stoddard for their updates, I also want to recognize some recent awards and honors earned by our county government departments. Montgomery County won 41 National Association of Counties Achievement Awards recently, including 2 Best in Category awards for the Senior Planet Montgomery Home Edition and for the COVID Corps. And the Montgomery County Department of Transportation has received the Technology Award from the Computing Technology Industry Association in the category of customer service. And finally, the Montgomery County Chamber of Commerce has nominated our Chief Procurement Officer and Director, Ash Shetty, as the 2021 Public Sector Partner of the Year, and he will be recognized at their annual awards tomorrow. And I want to congratulate all these employees for their hard work and to earn these accolades. And I want to call out Ash for his work in the Department of Procurement, where we have done major lifting to begin to change the reputation that Montgomery County has had over the years as a difficult place to do business and not an open place to do business. We are working overtime to make sure that we change that perception, because we know that perception is one of the weights that always hangs over the county as we're trying to attract people here. So it's great to see that the Chamber is recognizing the work that's being done. And I'll now turn it over to Dr. Gales and Dr. Stoddard.
Hi, it's actually Dr. James Bridgers today. Thank you, Mr. County Executive. Go ahead, Dr. Bridgers.
Thank you, Mr. County Executive, who gave some great data points regarding where we are. We continue to see low transmissions at the community level. Our test positivity rate is the lowest in the state, and our case rate per 100,000 is the second lowest. We continue to work with the Maryland Department of Health and monitor surveillance data reported from the World Health Organization regarding the transmission of the Delta India variant, the B.1.617.2. We don't have any cases in Montgomery County, as I'm aware of, doing this press conference. We continue to work with our community hospitals and all our data points to monitor those transmissions and or cases. Again, I'd like to thank our public and independent school systems for supporting our 12+ vaccine strategy and working with us to establish those clinics. We have a second dose clinic scheduled today at Argyle Middle School and at Montgomery Blair High School, our first dose clinic from 12 to 7, and we encourage all to get vaccinated so that we can continue to eradicate COVID-19 in the county. That's all I have, subject to any additional questions. Just wanted to share that. Lastly, just to emphasize the variants, we encourage folks who are unvaccinated to get vaccinated. The data points indicate that that's where we're seeing those cases being transmitted. And those individuals who haven't received their second dose, we talked about this in a couple of press conferences previously, but we need individuals to return to get their second dose administered so that we won't have any further transmissions or limit the transmissions of those variants at the community level. I'll stop there and turn it over to Dr. Stoddard, or back to you, Lorna.
I think Dr. Stoddard is next. Go ahead, Dr. Stoddard.
Thank you. I just have a couple comments. So we've gotten questions about the Germantown mass vaccination site. We're still doing about 150 to about 210 or so first doses a day at that site. Approximately 50% of those on any given day are for those minors 17 and younger, and obviously the other 50% are 18 and over. And so given that we are maintaining that site operation, I know there is a drawdown, as the governor said. The goal when he set forth these mass vaccination sites was to put themselves out of business. We are seeing a decrease in Montgomery County, as has been seen across the state, but we're not at the point now where we've quite put the site out of business. So we'll continue to utilize the site while people are continuing to come to it. And so I wanted to give that update. I did want to give some context for one of the numbers that the county executive previously provided, where today we're at 71.7% of our 12 and over population having been quote unquote fully vaccinated. But, obviously that means really just 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson. For context, the United States general population crossed 50% in that number today. So we are nearly a full 22% ahead of the national data. So just to give some context to just how much more effective our vaccine distribution program has been, but also just how much more our residents have willing to step forward, pull up their sleeve, and get vaccinated. So that's great news. really what we are doing now is we as a county are trying to encourage people to reap the benefits of the hard work that they have taken to reduce COVID-19, to make it safe within our community, to get vaccinated and make it safe, not just for our adult population who can be vaccinated, but also those who can't. So obviously, now is the time when we can start to do more activities, come out and visit some of our great local businesses, and take advantage of all the hard work that the community has put forth into this effort to get us to this place. So I will stop there.
Thank you, Dr. Stoddard. And now we're going to open it for the Q&A portion of this presentation. And the first questions come from Kate Ryan, WTOP, who has questions for the county executive, Dr. Bridgers and Dr. Stoddard. Kate, good afternoon. Are you there, Kate?
I am.
There you are.
A little mouse problem there. So you've answered a number of my questions on, and particularly the Germantown operations, and you said 17 plus. I'm kind of surprised that you're not seeing more 12 plus. Do you know why that is? Do they go to other school-based clinics, or where are we with that population?
So 50% at the Germantown site are 12 to 17 years old, and 50% are over 7 or 18 and over. I mean, the reason why that's important is because we have talked, one of the things that the other mass vaccination sites have done is converted to Johnson & Johnson as a way to wind down the site activities. Unfortunately, Johnson & Johnson is only approved for adult populations. And so because we're still seeing 50% of the people coming to the Germantown site being a group that's not indicated for the Johnson & Johnson vaccine at this point, we have not made that conversion over, and therefore are not in a position to start to wind the site down. There's still too much interest and too much, we're doing too many good vaccinations at that site to close it down at this point.
Makes sense. Thank you. And then in terms of the stats in the county, how far ahead are we when compared to other counties? And can you account for it? I know Howard County is either very close, neck and neck, or by one calculation, I think of theirs, ahead of Montgomery County. Can you address that?
I guess I think one reason we've done so well is that we've had not much resistance from the residents. I mean, from the very beginning, we've had a pretty consistent message, and nobody has seen us 1 minute saying we want to open things up, and then the next minute saying, oh, we want to shut things down. We've consistently said we were going to err on the side of public safety. We were going to minimize the damage to our residents and the loss of life and the illnesses, and all our policies from the beginning have been focused on that. And I think the consistency of that message has really helped. And the fact that residents can see the results. So, if you were a county resident during the previous spikes, you would see the numbers that were going up in other counties, and you would look at Montgomery County, and it's like, we weren't doing that. And that's important because, we were the first one hit. There was a point when, we were first or second highest, and us in Prince George's County had most of the cases in the state, because they landed here first. And this was in the days when we didn't have masks, we had no protections, we had no tests. It was a mess, but we turned that around really quickly. And what we learned from that is the things we knew we needed to do, which was suppress transmission, get people into masks, minimize the opportunity for people to move the virus from one person to another. I think residents saw that it worked. I think they were able to look at other jurisdictions around the state and realize it's not happening here in Montgomery County. Our air isn't different. Our water is not different. We have, some of what you might say, we have factors that in other jurisdictions would be problematic. We have great racial diversity. We have, great economic diversity. We are a poster child for reasons other people give for why they're not able to be successful. We were successful with all that. And I really do think it's the messaging, the comms work we've done, the consistency of what we've done. And, Howard County's a third our size, I think, and more rural. So, a lot of it is just basically, I think the messaging and the work people did here.
Got it.
If I may add to that, I think there's a one point I would add. Number one, we've got a very educated and engaged community, which obviously helps a ton. But I also do want to give some credit to the county executive because he pushed access and equity very, very early on. And I think that was one of the best things that we did, is really get invested in that and start the messaging process on getting people who are not necessarily as connected to government or the news cycles, and really trying to reach out to them very directly. And I think that played a huge role in where we've been very successful in reducing the gap, the racial and ethnic gaps that are being seen across the country. We started to focus on that very early on. Even when we had tons of people coming in, we knew that we were going to have this work on the back end. And so we started on that earlier. And I think that's helped us. That's why I think we're so far ahead of the national average in some of these vaccination rates, is that number one, the population is hugely engaged for the most part. But then number two, where they weren't as engaged, we invested and focused early on trying to reach those populations.
Got it.
And just to add to that, as Dr. Stoddard and Mr. Elrich indicated, we included our minority health initiative partners. So we really got down at a grassroots community level. If you recall, when we had 30 test kits, Mr. Elrich pushed for us to get more test kits so that we can mitigate and suppress the transmission and moving into our vaccine rates. And now, as we look at our ongoing vaccination program, we are looking at including testing and vaccination so that we can include those individuals who may be asymptomatic or may have a risk for exposure, so that they can have greater access through our equity plan as well.
Gotcha. Quick follow-up on the questions that you had about mask mandates by independent businesses. And Mr. Elrich, you've said very clearly that, look, businesses are within their rights on that. The question about if a business can mandate vaccination, I may be asking you a legal question. Do you know why they can they not do that? Or is the county not able to enable them to do that? I know it gets a little complicated. But
I couldn't enable anybody to do anything like that. That's beyond our magical powers here. There's a lot of stuff been written by lawyers about whether this is possible. My reading of most of the reports, including stuff in the Washington Business Journal, is that an employer could require it. Whether you would require it is, depends a lot on what your relationship is between the employer and the employees. But again, the county can't give that advice. But there are plenty of resources. All somebody's got to do is Google, can vaccines be vaccinated, and then look for somebody who's legitimate as a source. And I think most people can figure out who the legitimate people and who the illegitimate people are, and see what they have to say. But I don't think it's a bad thing, and I'm very supportive of places that require people to put their masks on when they come inside.
And to follow up, Dr. Stoddard, I know early on you guys were out there working with businesses, some of whom didn't want to have their own employees, masked, et cetera, and resisted. Are you getting a lot of businesses now saying, please help us because we have signs up saying, look, we want masks on? Are they getting pushback from people, or are we more in a position of everyone kind of is really acclimated to this? What's the lay of the land?
I think we're in a trend. There's an ebb and flow to this. I certainly think we have heard from the chambers, particularly, that some of the businesses wanted to maintain mask mandates for longer periods of time, and they wanted to make sure that the county was messaging that they were permitted to do so. And so we obviously have been very supportive of that, as the county executive said. So not so much from individual businesses, but more vocalized through chambers of commerce, not just the county chamber of commerce, but also the municipal and others that are representative of business groups have raised it as a concern, because they just want the businesses to be able to make their own individual choice based on the circumstances of their facility as to whether they want to maintain it or not. And so we have been supportive, as has the governor, of that being something that they can do. And so, I think that I think that what we're seeing now is, and we all see this even in our own personal lives, when we go to businesses, we kind of try and figure out, is this business requiring it or not? And, obviously the signage doesn't get changed immediately in some cases. And so there's just this transition period that's going on right now. And I think we're slowly seeing people starting to understand that There are many settings where you can wear a mask but aren't required to, and people are starting to feel more comfortable making that individual choice in various settings. And there are places where it's simply still required, and I think people are adapting to that as well. So I would say in Montgomery County, we have a lot of people who are going to wear face coverings for at least the foreseeable future because it's a choice. And obviously that's their choice to make. And I don't think there's any problem. Obviously, people should not feel like they need to sit home and do nothing. And I think they should feel, again, they should feel comfortable reaping the benefits that we have all put so much effort into. I say the collective all, not just government. Everyone in the community has put in a lot of effort to get us where we're at now, and people should feel comfortable reaping the benefits of that, whether you choose to wear a face covering or not.
Thank you very much. I appreciate it.
Thank you, Kate. Next set of questions. It's coming from Steve Bonnell, Bethesda Beat. Steve.
Good afternoon, everyone. More of a long-term questions here, but where are we at in terms of, I know we haven't had, God forbid, a lot of spread of the variants of the coronavirus, but I'm wondering what you've heard, Dr. Bridgers or Dr. Stoddard, on research for kind of vaccines to really tackle any variants that might pose a problem. I heard anecdotally that Novavax might actually be kind of leading the charge on this a little bit, but just wanted your insights on that, I guess, to start off.
I'm happy to start, I guess. So most of the vaccines that have been tested, I think, have been very effective against just about all of the variants we've seen so far. I think the worst that we've seen performance, there is a reduction. I think Moderna came out and I believe confirmed that there is a reduction in efficacy against the 516 or 560, whatever the India variant is.
17.2.
Yes. We don't like to use the country identifiers, but often those are the ones most commonly quoted in the media. So remembering exactly the numbers is challenging. They really need a new way to term them. But I think that's the one variant where there has been some reduced efficacy. But even in that case, the vaccine's like 70-75% effective, which candidly is just about as effective as our annual flu vaccine is against the flu strains that are floating around. And so, I don't expect, we have not seen a true vaccine escape mutant that is, where there's been a wild reduction in vaccine efficacy. It is possible that as long as we have a pool of unvaccinated people, that there is going to be some selective pressure on the virus to try and escape the vaccine. There will be. We have not seen it. So obviously it's something that the collective scientific and medical community is monitoring. We're sort of paying attention to that data. It may not ever happen. So it's not like, there's no doom and gloom necessarily, but we just want to continue to monitor that. So, while we are reaping the benefits of what we've done so far, that doesn't mean we're not going to stop being vigilant and paying attention to the information, the data that's coming out. I read the scientific journals and literature on a daily basis to try and make sure that we're staying up on just what's emerging around the world, because obviously we know in a very connected society such as we have, our first cases were literally from a riverboat trip in Egypt in Montgomery County. And so we know how connected we are in Montgomery County to the rest of the world. And so we're going to pay attention to what's going on around the world with these variants.
Sure, Steve, and just to add to that, as Dr. Stoddard indicated, the best strategy now based on the surveillance and the data as we continue to monitor the variants and their lineage is to have those unvaccinated folks get vaccinated and those individuals to increase the efficacy of the vaccines to have their second dose so that they can become fully vaccinated 2 weeks after they receive their 2-dose or 1-dose vaccine. And so that's pretty much the push and what the scientists are encouraging.
Just to clarify though about Novavax, because that's something I heard anecdotally. Are my comments about that unfounded? Because I think obviously Novavax has a local location. So just about, if them and other companies are kind of, now that we have 3 major players, for lack of a better phrase, if they're pivoting to, if a variant kind of takes hold, for lack of a better phrase, is that what you think's going on? I know that's kind of broad, but
the answer is yes. All 3 of them are pivoting to, I think Pfizer and Moderna have already commented about boosters for their respective vaccines over the next, let's say 6 months or so. and they would largely focus on those additional variants that emerge. Because that really, I think you have to figure out which variants are going to be self-limiting, or which ones are going to, outcompete other variants, so that you really want to focus on those. And I do know Novavax is focusing on a joint influenza COVID-19 vaccination, which obviously could be utilized as a sort of a supplemental booster as we approach the end of summer, early fall, when we would normally give out the flu vaccine, so you can get a double boost protecting you both against flu and also potentially the COVID-19 variants. And so that is something that they are working on, and I believe that they're reasonably close to being able to submit an emergency use authorization request to the FDA for. And so I think we'll probably be hearing a little bit more about that during the visit that the county executive and I believe the governor make tomorrow. Yep. So I think.
And just to add, one of the things about, the Novavax vaccine is they attack a different part of the virus. And, it's not an mRNA vaccine. It's a different vaccine, and it's targeting a different structure in the virus, and they have reasons for going after that structure. I don't think anybody's going to sleep on this. To Dr. Stoddard's point, everybody knows that a virus can mutate. No one's going to be sitting around waiting until we're dealing with something that spreads out of control. So I think people are working at this pretty constantly. It's kind of the logic between the effort to bring a pandemic center here, frankly, is to be prepared for the next thing, which means not just what could happen with COVID, but what could happen with other virus candidates that we know have the potential to mutate. And so hopefully one of the lessons that everybody takes out of this 15-month rolling disaster is that we actually could be better prepared, and we could be in a position to bring things into public use sooner if we know more about these things before they hit us and before they mutate to the point that they're as dangerous as they are. So I'm hopeful that we take lessons from this. It's sort of like the county taking the lesson that it might be a good idea to have PPE, personal protective equipment on hand before the virus comes, rather than trying to buy it in the middle of the virus.
And then lastly here, I know there's been some reporting about, even for COVID, these COVID vaccines, that perhaps in the years to come, you're going to have booster shots like the influenza disease. Is that, just what's the latest on that you two or three are looking at, I guess, in terms as we move beyond in the years after this?
So from a county health officer's perspective, we haven't had any significant conversations. There's been some discussions, but it's still been kind of vague right now as to whether or not what the strategy will be. We are planning for any boosters or considering any boosters as far as our continuum of health, and looking at, as Dr. Stoddard indicated, any varied administrations of vaccine, be it a COVID-19 vaccine and a combination of influenza vaccine or a booster, but there's been no definitive or concrete discussions with that now as we currently speak.
I would only add that I think that our hope is that it will be, if there is a booster, it is rolled out much like the programs are in place for flu, which is they go to pharmacies and primary care providers. I would not anticipate, or we would hope that for access purposes, not because the county's lazy, we I don't think mass vaccination sites are really what we're talking about for the booster, just because it's we want to get people closer to where people are, more convenient, more access. And so obviously, hopefully a booster, if it's required, would be done through a mechanism more similar to what people are accustomed to for annual flu vaccines, where there's lots of opportunities, employer-based vaccination efforts, et cetera, as opposed to having these massive, large-scale vaccination sites. Because the other thing is obviously one of the, I don't want to call it benefits, one of the side effects of having done this vaccination effort so far over a 6-month or so period is that the vaccines that people have received are going to be therefore spread over a 6 or so month period. And therefore if you make it time-based after your first vaccine, it's going to naturally spread out the time frame for a second booster, or sorry, in some cases, the third booster shot.
So as I understand that the state actually knows everybody who's gotten the shot. And to Dr. Stoddard's point, this would avoid the mad scramble of everybody desperate to get vaccinated. We know when you got your shot. We can, project how many doses we need in the month of January, February, March, whatever the time period is that a person needs to get a booster, and we can do this in a rational, calm way, as long as we secure supplies and get them in place. And I'm hoping the state, works with us to make sure this can be put in place. This should not be a county by county effort, much as we had to do the vaccines the first time around. This really needs to be something driven by the state in making decisions about how many vaccines to acquire, when to acquire them, and make sure we notify people off the database about when you're going to be due for your booster shot. So we can do this a whole heck of a lot easier than we did this first round.
Thank you, everyone.
Thank you, Steve. I'm taking a look at the chat here. I do not see any more questions from members of the media. Reporters, going once, going twice. None? Can I take a question from Facebook? This is kind of interesting. When will we know if the 4th of July fireworks is happening?
I don't think they are, because you have to buy fireworks long in advance. These big setups and everything aren't just sitting around in somebody's warehouse, and we had no way of knowing whether July 4th would be a day when we'd all be getting together, or whether it'd be like, the 2 months earlier. And so nobody bought fireworks in preparation for an event we didn't know we could hold. And so I don't know whether any of the smaller jurisdictions made any allocations of fireworks, but I don't believe we went forward with fireworks purchases this year, not knowing whether or not we'd be able to do this.
Thank you, Mr. County Executive. And we do have a follow-up question from Kate Ryan, WTOP. Kate?
There we go. Thank you very much. This is a follow-up on an unrelated topic. Mr. Elrich, my understanding is, and this has come to my attention today, that a group who's concerned about noise and operations at Air Park has written you a letter. They want some action from the county on, they say the county does have the power to curtail some of the noise and volume. And by that, I mean, amount of air traffic coming in and out of the air park, and that they've long had these concerns. Have you gotten that letter yet? And do you have any response for them?
We actually are having meetings on this, and there is an air park meeting. I'm looking, it's June 22nd to June 23rd. We're going to be having an air park meeting, and you can go, I guess, what's the website on this? Montgomery County Air Park. So you could Google that. There will be a meeting. Look, we've been looking at what we can do, but we are largely restricted by the FAA. This is an FAA licensed facility. They are, one of the conditions is they're authorized to do practices, so I can't make them not do practice. I'm not even sure I can limit, as the county, the number of flights that go in and out there, but there may be some things we can do. I mean, one concern that people have raised, and I think, needs to be, certainly enforced, is people following flight patterns. It has been raised for years that, every once in a while, flight plans are routinely followed. And then in other times, pilots aren't necessarily following the flight plans. So we're going to go into this again, figure out how much of this we can regulate. But we can't do anything that impairs the operation of the station, and we don't have authority over areas that are controlled by the Federal Aviation Administration. So we will look at it, and we'll do what we can do.
Thank you.
Thank you, Kate. Thank you, Mr. County Executive, Dr. Bridgers, and Dr. Stoddard. I think we're done for today. Thank you for joining us. Stay safe, and we'll see you again very soon. Have a great afternoon.